Hi, welcome back to Ask a Dentist, a show where we answer questions related to dentistry submitted by users online. I'm your host, Alex, and today we have a special guest. Let us welcome Dr. Emily. Hi, Emily. How are you?
Hi Alex, I'm fine. Thank you for having me on the show.
And thanks for taking time off to come to the show. So, the topic for the show today will be... thanks for putting the question on the screen. I wonder too. Okay. What is this? Oh, it's MIH. So, Dr. Emily, the floor is yours. Please explain to the audience what MIH is.
This is MIH. MIH is molar incisor hypomineralization. It's a syndrome defined by alteration of calcification. Some people call it cheese molar because it looks like a cheese. Only affects permanent molars and or incisors. We can see the characteristic of it is circumscribed and non-symmetrical. Let's take a look of sign of MIH. First, it only happens in permanent teeth, molar and incisors. Second, the color of the teeth looks yellowish and brown without the bright. Third, usually affect occlusal surface and incisor area. Fourth, cervical thirds normally are not affected. Fifth, diagnosis of MIH should be present at least in one or more molars. According to the epidemiological study, prevalence of MIH can be ranged between 2.8 up to 40.2%, but this variation may be due to a lack of standardized tools to record MIH, leading to underestimation of prevalence. The prevalence of mineralization defects is greater in medically compromised children during childhood, for example, asthma, medial otitis, pneumonia, urinary infection, fever, and premature.
And how does MIH happen?
The causative mechanism of MIH is still unclear. In general, the condition seems to be multifactorial and systematic factors, for example, acute or chronic disease or even exposure to environmental pollutants during the last trimester of pregnancy. And MIH was described as a developmental qualitative enamel defects caused by reduced mineralization and inorganic enamel components which lead to enamel discoloration and fractures of affected teeth. Obviously, the answer would be yes. The influence can be first, patient may feel sensitive on teeth. Second, due to the pain, patient doesn't like to brush the teeth, even reject the dental environment. Third, rapid caries progression can be happened. Fourth, dental treatment will be the challenge.
Then how can people with MIH protect their teeth?
Normally in the dental clinic, we can separate our treatment in three phases. First, for prevention, we can apply 5% fluoride varnish like Durafit on the affected teeth. Second, if there's a cavity, we can clean the caries and fill the tooth with composite or glass ionomer. Third, if the tooth is heavily destroyed, better to place a crown.
Thank you. As you seem to have quite a busy schedule, this will be the last question. Do you have any additional suggestions for the audience?
My advice is, first, take the children to dental practice regularly. Second, if MIH appears, consider to use a toothpaste which is recommended by your pediatric dentist. Third, brush your teeth after each meal.
Thank you, Emily. I believe the audience has learned a lot from your talk today. Well, everyone, this will be the very last episode of Ask a Dentist. Thank you very much for supporting us all the way, and I wish everyone live long and prosper. Bye!